I am so honored and grateful to be here at Advent Health, serving in the role as Chief Diversity and Inclusion Officer. I'm especially looking forward to the opportunity to working with my colleague, Dr. Ulrich Simmonds, who's serving in the role of Chief Health Equity Officer. Together, I believe that we can make Advent Health a place where our team members, our patients, and the communities we serve all feel valued and welcomed and a sense of belonging. One of the most pressing challenges we face here at Advent Health continues to be the coronavirus response and the rollout of a vaccine nationwide. And given the disproportionate impact that COVID has had on communities of color, it's also a subject that touches on matters of diversity, equity, and inclusion. And that's why, Dr. Ulrich Simmonds, I wanted to have a conversation with you as our Chief Health Equity Officer. Dr. Simmonds, communities of color, and especially African Americans, continue to bear a disproportionate COVID-19 burden, both in the rate of infection compared to the demographic distribution of society and the severity of infections. Why is that, and how can we curb that?
Yeah, that's a good question. I mean, COVID has been the perfect storm epidemiologically. It is a unseen, unsmelt, unfelt culprit that affects people who live in dense population areas. There have been some studies published in the New England Journal of Medicine that demonstrates that one of the greatest risk factors for contracting COVID is whether or not you have to catch public transportation to and from work. So any place where people are gathering en masse and traveling en masse increases the risk dramatically. And unfortunately, in addition to a COVID inequity, there's also an income inequity that people of color unduly bear. That does not allow them to work remotely, that forces them to have to take public transportation to and from work, and exposes them to large crowds of people. So we think that's part of the problem. And then it's also an exacerbation of some of the old problems around access to health care and the pre-existing conditions that makes one not just susceptible to the illness, but susceptible to having a bad outcome once contracting the illness, right? It's important we remember that 80% of the people who get COVID will do just fine. It's those 20% who have the pre-existing conditions. And unfortunately, the state of health for minority communities in this country have always been laggard to that of the majority.
I'm glad you brought that up, Dr. Simmonds, and we have learned that one reason many people, and especially communities of color, are hesitant to get the vaccine is because of mistrust in the healthcare system, mistrust in government. And many communities have valid reasons, actually, to think that the healthcare system doesn't have their best interest at heart. So our country has a shameful history of abuse with minority communities when it comes to clinical trials, for example. And even today, as you mentioned, there's continuing inequality when it comes to access to care. What is your response to concerns of mistrust? And I ask you to answer that both from the lens of a physician and, if you will, from the lens of a father, a son, a husband.
Yeah, I'll take the latter of that first.
Yeah.
Being a surgeon, I was able to get the vaccine very early. My mother, who is a breast cancer survivor, lives with me and is older than 65, and she's yet to be vaccinated because we don't have vaccine available to her. And so some of the precautions we've taken in our own house are no sleepovers with the kids. We limit her exposure. She's allowed to go to Costco and Publix and then stay tucked in the rest of the time. And I think that we're not uncommon in that vein. There are many of what we call the sandwich generations who are both managing their children and their parents. And COVID concerns limit the things that we can do with our loved ones. As a physician, I would say we have to, as a medical body, understand that it is fear that is predominating the thought process of minority communities. It is distrust. And we have to posture ourselves in a position that allows us to, one, say to communities, we understand your fear and it's justified. You are not out of your mind to feel this way. We hear you, we see you, and we understand. That is the only way we begin the dialogue to gain their trust back, such that they can make the right, responsible choice that will get us beyond this pandemic.
Dr. Simmonds, thank you for that insight. As you bring up the word fear, I think of another concern we're hearing. a lot of people feel as though the vaccine was rushed. It came too fast. Is that something you can respond to? Do you have any insights into why things happened the way they did?
Yeah, I think that's a big question and one that I hear a lot in the community, even with colleagues. And the reality of it is that the technology has advanced. Technology in many different things have advanced. We have autonomously driving cars. We have a spaceship that goes up and lands back down on a moving vessel and is reused several times. SpaceX went to the International Space Station using iPad controls. So technology in a number of different science fields have advanced, and the same thing has happened in medicine and virology as well. So the use of messenger RNA vaccines has been a novel occurrence, but the science that has led to the accelerated pace by which this vaccine has been released has been worked on for years. What we have seen is the product of successful science using messenger RNA vaccinations, and that's why it's available so quickly. In addition, Operation Warp Speed allowed these companies to really focus solely on creating a vaccination. And so, while again, I understand the concerns about that, a wise man once told me an acronym for the word fear, and it's false evidence that appears real. And I think that's what's happening here. We falsely look at the rate of which a vaccine has been prepared. We accept that as real, and it causes us to be stagnant in taking the action that we need to do to prevent, in this case, minority communities from suffering a 3 to 4 times death rate from COVID infection.
Dr. Simmonds, as you say that, we understand why people feel fear, of course, and some of it may be generated by disinformation and external factors, but some of it may be generated by internal factors, personal factors. We have some people with pre-existing conditions. We have some people who are considered to be at risk or are pregnant. And some of those conditions that also exist are diabetes, asthma, and the list goes on and on. What about those individuals as they're thinking about what the appropriate next step might be for them when it comes to the vaccination? How should they approach thinking about it?
I would hope that those who have pre-existing conditions would rush to be vaccinated. Mm-hmm. Those are the patients who we know are the most vulnerable and who have the most untoward outcomes. You can kind of segment the group of the population and say those who have COVID and will stay home and do well. Those who have COVID and will come to the hospital and require hospital care with oxygen and the like, and then those that get to the ICU once they're in the hospital. When we talk about the death rate that we see disproportionately amongst minorities, they are falling into that latter subgroup that require ICU care and then end up, unfortunately, dying. And so to those who have pre-existing conditions, I would hope that they would become some of the earliest groups to become vaccinated. The group around pregnancy, the women who are of childbearing age, women who are lactating or considering becoming pregnant. Actually, the American College of OBGYN has recommendations for them. And they have been very explicit in saying that women who are pregnant or breastfeeding should not be delayed from getting vaccinated.
Wow.
And I think that's a very, very important thing. This is the certifying college that gives board certification to OBGYNs to practice, and these are their recommendations for the patient population that the doctors who are board certified in obstetrics and gynecology are following. So I would hope that coupled with the fact that the frontline doctors and nurses who are caring for patients who are pregnant, patients who have diabetes, patients who have hypertension, we have all been vaccinated. And we've been vaccinated so we can remain in place to take care of the community. Our hope is that the community would get vaccinated so we can get control of this disease and move forward with our lives.
Dr. Simmonds, another question is around side effects. Mm-hmm. Not just the side effects that might happen immediately, because based on the number of people who have been vaccinated already, we're seeing what that looks like. But folks are concerned about longer-term side effects that we might not know about. How would you respond to those concerns?
I think there's a couple different things to think about. One, there are some side effects, particularly more after the second dose than the first, but they're mild. So after the first dose, one could expect that your arm will be a little bit sore, maybe fever, maybe headache. That really is the extent of it, except for people who have hypersensitivity reactions, what we would consider to be anaphylaxis to things like peanuts or shellfish. And those patients usually require an epinephrine pen, and they'll know about those things beforehand. The other thing that I would say is that most of the population has been vaccinated multiple times in the past. If you've attended school, if you played a sport, you've been vaccinated probably for measles, mumps, rubella, diphtheria, pertussis, tetanus, and we've all done fine. I think, again, this plays into the fear around how quickly this vaccine was prepared. But the clinical trials show that this is an incredibly safe and incredibly efficacious vaccine to prevent the untoward events from COVID-19.
And Dr. Simmonds, as we wrap this conversation, do you have any final words?
I think I would just say that action cures fears. And we understand the fears and the hesitancy of why people would be skeptical about this vaccination, but we have to hold space for that, continue to be in dialogue with them, continue to win their trust, continue to put science and data in front of them so that they can make the responsible choice. That's the only way we're going to diminish the death rate that we see, particularly in our Hispanic and African American communities.
Thank you, Dr. Simmonds.
Pleasure. Thank you.